Wache, and welcome. This is Anne from the Sioux Lookout Practice Consultant Team, and you're listening to the Practice.Support podcast, the one and only show that discusses new practice updates and changes for ISC's Ontario region. Coming to you with acknowledgement to the Anishinaabe Algonquin Nation, whose traditional and unceded territory this podcast is recorded on, and with respect to the different traditional Indigenous territories of Turtle Island that this podcast may find you. Hello everyone. Today we have Kevin, the nurse practice consultant for the Kashechewan and Peawanik nursing stations in the Moose Factory region. He comes with a varied background including Emerge, EMS, and is an instructor for advanced trauma core courses for nurses at St. Michael's Trauma Program. Welcome to the show, Kevin.
Thank you for having me. It's great to be on the show.
So Kevin, what are we speaking about today?
So I wanted to talk about trauma resources to have in the nursing station.
That's a good one. Why is this important to the nurses up in the north?
Well, within northern settings, trauma rates can be up to 8 times greater than the Canadian average. Blunt trauma accounts for 80% of trauma cases. Penetrating trauma and burns make up the rest. And it's really important to understand the resources we have available to us so we can improve trauma outcomes and try to reduce the mortality and morbidity in northern communities we serve.
Those are some serious figures. Can you speak a little bit more to this?
I can. So as listeners are aware, most northern communities lack immediate access to a trauma center. And the access that we do have is limited by weather, distance, and the remoteness of our work setting. And even though the northern setting has higher trauma rates, it doesn't mean we practice trauma care all the time. And trauma care can involve a number of higher risk procedures and treatments that we may practice at a lower frequency. And as such, being ready and able to perform appropriate trauma care when it's needed is key to increasing our patient survival rates and outcomes.
So what would you suggest nurses be familiar with to better improve their trauma care skills?
Well, that's a really good question. So trauma care varies case to case. But we do have a variety of resources that we want nurses to be familiar with. And we can look at this through sort of a case. So imagine if Anishinaabe Police Service or your local law enforcement agency phones you about someone who falls 20 feet off the roof and struck a pickup truck upon landing. And you know that their head and torso were struck on impact. And they're about 10 minutes away. We know we want to do some things to prepare and for when this patient arrives. So we'll always start with our CABCs, so control life-threatening bleeding, and then focus on the airway, breathing, and circulation. So we'll want to gather and ready a variety of equipment and be aware of where it is and that it's in working order. And a few other things we can do is call your team in as soon as you're alerted so you can prepare for such a case. A few things to mention. So we want to make sure we have our airway adjuncts, supraglottic airways, and suction equipment. And we also want to know where our C-collars are and the Churchill needle is for a needle decompression. We also want to ensure our Lucas device is functioning and that we have our IV pumps ready as well. Additionally, you may want to consider something like a combat application tourniquet in the case of a massive hemorrhage. You may also want to know where your pelvic binder is. And then often forgotten, but we want to make sure that our bear hugger and warm blankets is readily available. In regards to our pharmacy resources, we want to make sure we know where our TXA is and check for Ringer's lactate, as it's a commonly used fluid in our trauma patient population, and ensuring that the iStat cartridges are ready. This is also a good time to access our telemedicine resources, which is crucial to our care in the north. And so making sure your numbers are all available for your on-call physician, your specialist supports like the ICU nurse or respiratory therapy, If you're in the Moose Factory zone, you'll want to make sure you have access to the Waha Emergency Department number, the Orange phone number, along with the VCCR, which is the Virtual Critical Care Resource, via Sudbury, along with prompting your physician asking for that support. And if you're in the Thunder Bay zone, you'll want to make sure you have access to the RCCR for the Sioux Lookout communities. But all of those interventions above will help us contribute to maximizing survival rates for our patients by being prepared.
That's a really great point, Kevin. An often overlooked hemorrhage intervention is having that warm blanket or bear hugger around. It's very tempting to think of those as winter interventions and slide them away. So, what other resources can be found if nurses want to build on that trauma preparedness?
So, most of the equipment has a job aid or iTacit module that's either ready or soon to be released. So that's a good starting point for staff. We also have the One Health Trauma CPG, which has been updated and we'll have more updates, but that's also a good resource. And then we also want to remember kind of the back to basics with some of our additional coursework. Much of the skills and equipment that we've covered above is also covered in our ITLS course. So please remember to obtain and or renew that certification. And for staff who want to go more in depth, you can go to the traumanurses.org website or consider the Rural Trauma Team Development course, which is available through the Thunder Bay Trauma Program, but you would need to submit a training authorization for that course.
Those are some great resources. Thank you. It's been a great review of our trauma resources up north, Kevin.
Thank you, Anne, for having me. It's been lovely.
Thank you all for listening to the Practice Support Podcast. If you're keen to follow up on any of the information you've heard today, head on over to One Health and iTacit, where you'll find more links and resources. For more practice updates, don't forget to find and follow us on our Instagram, Facebook, and YouTube channel at Sioux Lookout Nursing Practice Support. And as always, if you have any questions, please reach out to a nurse practice consultant, an education practice advisor, or your manager. That's all for this episode, folks. See you at our next podcast.